sponsored by the Carpal RX. If you have hand pain or wrist pain, do you know how to tell the difference between wrist tendonitis and carpal tunnel syndrome? Each year, tens of millions of Americans get hand pain and wrist pain. Sometimes it's tendonitis, and sometimes it's carpal tunnel syndrome. Also each year, 500,000 Americans undergo surgery for carpal tunnel syndrome. Many times this risky surgery is unnecessary, and the lengthy recovery required, as well as the cost, are burdensome to many patients. So how do you know which condition you have? They're related, but quite separate conditions. You can take a series of tests which are identical to the ones a doctor will give you in his office. If you answer yes to any of the following tests, then you might have carpal tunnel syndrome. The first of these tests is called the Phelan test. With your fingers straight, flex your wrist gently and as far as possible. Then hold this position for 1 minute. Do your symptoms appear to get worse, or do you feel numbness? In the second test, or the Tennell test, with your hand straight, lightly tap the skin over your wrist crease. Tap left to right and up and back over the wrist crease. Does this result in a tingling or a pins and needles feeling in your hand? In the third test, or the Durkin test, with your hand straight, use your opposite thumb to apply pressure to your wrist crease. Hold it for 30 seconds, then relax for 1 minute, and then apply firm pressure again to the wrist crease for another 30 seconds. You can do this above or below the wrist crease. Do either of these make your symptoms appear or to get worse? Do you feel numbness? If you answered yes to any of the above questions, then you might have carpal tunnel syndrome. If you answered no to the above questions, then try the following tests for tendonitis. A tendonitis test uses a percussion test. Use your 2 fingers to tap your flexor tendons just below your wrist crease and tap all the way up your forearm. Tap all the tendons in the entire width of your arm and go up and down as you're tapping. Does any of this tapping cause you to have any pain or reproduce the symptoms or make them worse? If so, then you might have tendonitis. So whether you have carpal tunnel syndrome or tendonitis, what can you do? More than likely you've tried splints and medicines and perhaps have gone to a massage therapist once or twice. If you do have carpal tunnel syndrome or tendonitis, you owe it to yourself to try the Carpal RX first and take advantage of the 60-day free trial offered. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.